there has been already a number of aspects and provisions that have been placed, that is currently in place, and that is helping the whole aspect of the health disparity discussion. Just think about race and ethnicity. That is already being standardized, and all the federal agency will be able to have not only standardization for race and ethnicity and other key elements, but also would be able to have what we call the class indicator, the cultural, linguistic, and health literacy appropriate standards that needs to be followed across every single program related to health disparity. You have the community health workers that already, there's been funding becoming available so we could have culturally appropriate services delivery. There's mandatory for hospitals and clinic and many other sectors and health plan to really include and adapt those culturally appropriate and linguistically appropriate standards of care. So there's a number of things. I wish I had the time to elaborate more because I get passionate when I talk about the ACA, and I really believe that probably the law will be upheld, but that's another discussion. And then moving into the social determinants of health, here clearly is just to emphasize what has been said, that we need to recognize that social conditions affect health and can potentially be altered by social health policy and program. We need to truly believe that, and I truly believe so. And it is a departure from effort to address just on a single disease and causes, and that it acknowledges that we need to take a multidisciplinary approach to achieve health equity. And it calls for the improvement in a number of areas if we really want to get to the cause roots of the problem. And there's many, sociology and researcher, health disparity researcher, that have clearly indicate the close association between health disparity and the low socioeconomic status, and how, for example, American, regardless of ethnicity and race, without a high school degree, have death rate which is 2 to 3 times higher than those without a graduate degree, that you have adults with low socioeconomic status that has levels of illness that are in the 30 and 40, similar to those seen among the highest group of socioeconomic status. And the minority, we know that experience low levels of education, income, professional status, and wealth than white. And this particular chart just shows how when you look at people below poverty level, the African American and Latino